One thing I always say is policymakers should watch things like Top Boy, should watch things like The Wire, because it really brings about this concept of syndemics. So how do you have a syndemic where different risk factors add together to have a synergistic effect, which then is greater than the sum of the individual parts? So like with The Wire, you have living in a poor neighborhood, you have redlining, the same thing with Top Boy, you have draconian drug policies. Then you wonder why people now have increased risk of mental health problems, really.
You have found the Thinking Mind podcast. So this week we're super excited to welcome Dr Akeem Sule. Dr Sule is a consultant psychiatrist. He's working at the Essex Partnership University NHS Foundation Trust, and he's also conducting research as a research associate at Wolfson College in Cambridge. Dr Sule is well known as the co-founder of Hip Hop Psych, talking about mental health and hip hop music. He's the facilitator of the Association of Black Psychiatrists Culture Club, and he's also now developing his interest and conducting research into the representation of mental health in film and TV. And this is what will be the focus of our conversation today. So Dr. Sule, welcome.
Yeah, I'm so excited to be here, really. It's an honor to be here.
Oh, it's a huge honor to have you. So thank you for joining us. So Dr. Sule, to start us off, I was wondering if I could start by asking you, what has your journey been like to do what you do now?
Okay, so generally, you would be aware that I co-founded the Hip Hop Psych movement. I like to see it as a movement with Dr. Becky Inkster. And that started with, obviously being interested in psychiatry, but as I'm sure you can appreciate, most medical students don't want to do psychiatry. So when I was doing my SPR rotation at Oxford, I just realized we needed to pick their interest in psychiatry. So then it was like, why not use hip hop? You can use hip hop references and basically, I got the, students interested in psychiatry. My lectures were rated quite highly, and that continued when I became a consultant and started interacting with the Cambridge medical students. So I told Becky what I did, and then Hip Hop Psych was born. But I've always had a long interest in movies, and I'm one of these people where I'll watch anything. I have times when I'm interested in art house movies. There are times I'll watch TV shows like Keeping Up with the Kardashians. I could watch documentaries. So I would say I've casted a broad net. But then you realize over time that you're seeing lots of themes related to mental health. And being a psychiatrist, I'm always interested in it. More so, it's popular culture. And with popular culture, you find out it's a leveler between patients and psychiatrists. And you can begin to have those discussions. It's also a leveler between medical students and their lecturers. And so it begins to open an opportunity to have the conversation about mental health. And you add on to that things like TikTok, you have all these TikTok influencers talking on all sorts of things. So I think it's a very good way to promote mental health, to have the discussion by looking at depictions of mental health in movies. And another pet interest of mine, as I'm sure you can appreciate, is I'm particularly interested in when you think about Black mental health and racial trauma. Because I think in these days, particularly when you have the government talking about the leveling agenda, unfortunately, let's not forget about George Floyd. And initially that seemed to be tied, the leveling agenda was seen as a means to address equality among Black people in terms of mental health, incarceration rates. But what seems to have happened is that's taken a twist. And the focus seems to be on white working class, almost setting up the white working class against the inequalities that have existed against Black people and people of color. So I think now is the time to start having these difficult conversations. And I think generally films and movies portray that, and TV documentaries too.
What is your work in at the moment in terms of looking at depictions of Black mental health in film and TV, or what are you thinking about right now?
So generally, there are a number of fantastic movies and TV shows. And Anya, the honest truth is I don't know where to start. But let's start with, in my opinion, the greatest TV show ever. You watch this, greater than Game of Thrones, greater than The Sopranos. To me, it's The Wire. So The Wire, set in Baltimore, fantastic, covers themes as wide as, about criminal gangs, addiction, housing, politics, education, and stuff. Now, why do I think this is a landmark study in terms of mental health? And to show you how important this is, I was recently invited to work with a medical school in the States with a resident doctor, basically looking at how we could use the wire to teach on popular culture and also syndemics in terms of mental health. And we were able to design a course, but that's a talk for another day. But talking about the wire. So the wire is set in Baltimore. It's a predominantly Black area. The great thing about the wire, it brings the whole issue of redlining. And what's redlining? We know that in 1933, there was the Home Owners Loan Corporation. And this was a way of segregation. So we saw in Black communities and Latino communities, there was a chronic disinvestment, which means grocery stores, doctors were taken out of community banks and everything. And they were basically tagged as poor investment areas. So within that, you had an underclass of criminality, drugs, house prices fell. And if you're talking about generational wealth, predominantly Black and Latino areas were hit. And Baltimore is a city like that, really. So you see that in play. And when you look at those seeds, whether that is, unstable housing, poor education, drugs, and lack of social cohesion in the neighborhood, we know those are risk factors for mental health problems, be it depression, post-traumatic stress disorder, and psychosis. Now, The Wire is able to really have this discussion in a deep way. Moreover, it also tells you about the failed war against drugs. Another good show, by the way, is Top Boy, which is almost like the British version of The Wire. But really, let's talk about the war on drugs. So we know that there was in 1986, there was the Anti-Drug Abuse Act. And basically, loads of Black families basically got charged with being dope fiends. So there was this stereotype of the Black dope fiend. And basically, crack cocaine addiction was seen as a criminal problem. So you had tons of Black folk incarcerated. So think about the impacts on families. Think about how that impacted on families, how that created, incarceration, the impact that would have on another generation of people with mental health problems. Also think about the unjust laws. So at that particular time, Black folk got the same sentencing for trafficking in 1 gram of crack cocaine compared to 100 grams of powdered cocaine. So if Blacks were found with 1 gram of crack cocaine, you had the same sentencing as 100 grams of powdered cocaine. Why is that important? Well, obviously, the white folk were basically using powdered cocaine. And there was this myth about crack cocaine being more addictive to powdered cocaine. So Blacks were slapped with a lot of criminality. Now, let's flash back to where we are today. Look at the painkiller addiction, which has predominantly been among white folk. That being said, there's also an increase in opiate mortality among Black folk. But there's a more humane approach to it. Whereas then the approach was just say no. It was seen as a criminal issue rather than a health issue. So The Wire really unpacks that as well as Top Boy. That also being said, there are 2 characters that are really, really fantastic in The Wire. There's a guy called D'Angelo. And it's really interesting because D'Angelo is this chap that happens to be in a gang because there's a family history of, for want of a better term, criminality. But he has a conscience. So you see him when there are things in terms of selling drugs, you see him basically become very, very depressed. He ends up going to prison and he ends up self-medicating, basically using crack cocaine to lift his mood, which is not uncommon. So you basically see that in play. Now, there's this whole issue about whether you see people in these disadvantaged communities, do you see them as being people that can have moral injury? Let me break it down. You see soldiers in areas like in Afghanistan, but what of people in our own areas, like in places like Hackney? These are, well, I don't say similar conditions, but you have a social breakdown. You have people who end up selling drugs, and sometimes they have a conscience. You're selling drugs in your neighborhood, And they also could have a risk of moral injury because sometimes they're moral transgressions. But you see D'Angelo actually go through this and become depressed. You also see Michael B. Jordan's character go through this as well. But there's another great character called Bubbles. What I love about Bubbles' character, so Bubbles is one of the characters, a very smart person. So it basically breaks that myth about someone with an addiction being someone who isn't smart. We see him navigate the streets of Baltimore, but we also see his struggle with drugs. And like Prochaska and DeClement talked about the cycle of change, we see him go through the pre-contemplation stage, the contemplation stage, a stage of action, and a stage of lapse, and he relapses. And what I like about the show, it takes around 5 seasons before you finally see him enter recovery. And it's such a true account of what people go through in addiction. You also see the prominent role of Narcotic Anonymous, and we see how he gets his support. We also see his defense mechanisms, because Bubbles basically, rather than address his addictions, because he loses a friend of his, he tends to use humor. And towards the end of the show, we see him stand up in a Narcotic Anonymous meeting and basically bare his heart. And at this stage, he no longer feels the need to hide behind humor. And there's one thing he says, it's okay to have grief as long as you have room for other things. And basically, then he was consumed by grief, which made him feel guilty. And he didn't feel he deserved to be well enough to come off the heroin, to basically come off the heroin. So I feel that's a very, very good show. Now, Anya, I get excited by this. I don't know if you've seen this TV show, Euphoria.
I haven't, no, but I've just heard of it. Has it just come out? Is it
No, it's been out since 2019.
Okay.
It's got Zendaya, although the second season has come. And it's basically a coming of age.
Yes.
So there's been this whole discussion, is it a good TV show or not? What's interesting is it really looks at young folk, and it's very good in psychiatry, how we are taught how to take histories. So you see Zendaya, she comes from a middle-class family, you understand, but she has chronic anxiety. She also possibly has OCD symptoms, and her father dies of cancer. So you see all these multiple risk factors which make her use drugs. But what's very, very interesting, and what I like, is it also shows her going through depression. And it really shows it very well. You see her lying in bed. You hear her thought process, how getting out of bed is an effort. She can't even go to the toilet to pass water. And she develops a urinary tract infection. It also looks at her relationship with her drug dealer, who paradoxically is her friend. So I've invented this concept of the ethical drug dealer. Let me break this down, Anya, before I get, before people say it's controversial. So generally in psychiatry, we talk about harm minimization. So Zendaya's character, who is called Rue, gets drugs from this drug dealer. He's kind of a friend. He supplies her drugs, and she uses heroin. She basically uses all kinds of drugs. But there's time when she goes there and she meets another drug dealer who actually basically gives her fentanyl. Now, we know fentanyl is a drug which is several times more potent than heroin. And her friend first makes it quite clear he wants nothing to do with fentanyl because he knows it increases the risk of respiratory depression. Anyway, this drug dealer forces her to take it. She takes it because people with addiction, that's what happens. And she makes it quite clear she uses it to numb herself. She becomes unconscious. But what's really interesting is his response. What does he do? He brings up his naloxone kit. So talking about harm minimization and about how important it is that when people have addiction, you give friends and even controversially drug dealers, and he injects her and takes her to the hospital. So how many times, Anya, in our interactions with patients, do we ask them, what's your relationship with your drug dealer? Can you trust him? If there was a bad batchman going around, will he tell you? Because the honest truth is some drug dealers do it. We look at the impact of COVID. What happened during COVID? Regular drug supplies were disrupted. So some people had to source drugs from other drug dealers who might not have been as, in quote, ethical. And these are the kind of conversations that we need to have in terms of about harm minimization. You understand? Another TV show, and then I'll pause for breath, is looking at the UK. I've mentioned Top Boy, which is quite a good show because, again, at the beginning of the first season, you find one of the mothers of one of the chaps who has depression. And you see her, it's a real severe depression. She can't get out of bed. She goes to hospital. And it's also good to see her get better. So that is from a UK perspective. And I Will Destroy You. So Michaela, I May Destroy You, Michaela Coel's coming of age story. And what is fantastic about this TV show is, on the surface, it seems like a TV show about sexual consent. But you also have her see her therapist, because what happens is she is sexually assaulted after a drink is spiked. And I like the fact that she's not a stereotypical Black person down on her luck. She's a middle-class person. She uses drugs from time to time, but she doesn't have a problem with dependence. And you're often faced with this choice. How is she seen? Because often Black women tend to be judged as being Jezebelic characters. So when sexual assaults happen, do people take their complaints seriously? What tends to happen? We also see her go through therapy. And that brings up the whole issue about how Black women are treated in therapy. Because sometimes with Black women, if they express their anger, if there isn't that cultural humility from their therapists, who are more likely to be white folk, and we know about the referral for Black folk for psychotherapy, we get a sense that they're toned police, which means if they're not supposed to come across as angry, you understand? It brings up that kind of issue. And therefore, TV shows like In Treatment, which is in season 4, it's great to see a Black therapist treating Black people and addressing these issues of racial trauma and things like that. So there's just so many TV shows out there addressing all kinds of things. So I'll keep quiet because I could go on and on. There are tons more, but I'll just keep quiet for now.
No, I hope you will go on and on. I'll pick you up on some of those bits, and hopefully we can keep going and flip back. I mean, so many. I guess the first bit, which is one of the last ones that you mentioned, is the issue of Black people in therapy. I mean, I think one of my psychologist colleagues has talked about the fact that, like, Black men just you hardly ever see them either getting therapy or being referred for therapy. Or what do you see TV, film, popular culture helping people feel like it's for them and realize that it can be for them, or to make professionals realize that there's a gap in the work that they do, in the referrals they make?
Definitely. I mean, it's often said, Black people don't want therapy. That's not true. Obviously, it needs to be researched. But let's think about the issues going on here. First of all, there's a whole thing that myth that it's sophisticated folk that need it. Secondly, our psychotherapies, a lot of them are built on white, whether it's psychodynamic psychotherapy, Freudian stuff, you understand? How culturally relevant is it? But we've seen initiatives where it's like, train your barber to be sensitive in terms of discussing, well, not therapy, but befriending and low-key counseling. And how many of our therapists are culturally competent? But certainly, like the In Treatment. So In Treatment is a TV show. So in season 4, first 3 seasons are great, but in season 4, there's actually a Black therapist. And what's really interesting is the issue she brings it up. Now, in popular culture, there have been Black therapists before, but often they tend to be mommy characters. They tend to support the white person almost as a friendly person, like Blacks always supporting the white person. In this TV show, they're the central character. They're also basically engaging with Black people and discussing issues. And what I like about our TV show, it also brings up the issue of racism. There's one of the characters that the therapist is treating who is racist. And it's interesting, on one stage, he actually wants to take her seat. So all those kind of issues are played out. And I think it brings it to the forefront. Another good TV show is, there's basically this TV, there's this, why am I forgetting it now? Don't worry, it will come out. But it's this TV show by Issa Rae. This TV show discusses, there's a therapist there. And so I think these kind of TV shows basically start discussing the issues about Blacks in therapies, you understand? And it makes it more likely that they will take it. I May Destroy You brought up the issue of therapy as well.
And thinking about you've talked about kind of the public health impact on mental health and how difficult it is to separate, the two. And I think, as public sector workers, probably it's kind of by the by. And well, actually, I say that. I think in a way, probably we are very aware, either as health workers or teachers, police, we're very aware of the impact that people's social milieu has on their life, and like you talk about problems that get transferred across generations, and poverty, and how sticky these problems can be, and I think and obviously kind of a lack of awareness and a lack of knowledge of that leads to the kind of arrogance, like when people like abuse homeless people, or when people are disparaging towards people with addiction, or like get down on young people who might get labeled as problematic without kind of realizing that maybe they're not getting a meal, they're kind of being harassed by police on the way to school, they're all of these things. Can TV film change those views? Can they do they make people realize?
No, I think so.
We're all human, and
yes. I've just remembered the TV show. It was Insecure, fantastic TV show. Okay. Because and I'll address the question you said in Insecure, it's really interesting because Issa's character. So Issa is in a relationship with a chap who keeps on disappearing, who apparently ghosts her, as the young folks say, ghosts her. And then we find out he's got bipolar disorder. So the periods where he's elated and when he's depressed, he just wants to go away. And so it opened that whole debate about people with mental health problems, how much are they responsible for their actions? So when you look at the chat rooms on the show, people are asking, can he use his mental health as an excuse for ghosting? We also see Issa's boyfriend who has depression, you understand, and stuff. Now, about what you said about, should we say the homeless people or things like that, like shows like The Wire is good, you understand? And let's not forget Shameless. Shameless was quite good because Shameless, yes, you would argue sometimes for some of the characters perpetuates the thing about people on benefits, you understand? Or Benefit Street, which I sometimes think a show like Benefit Street, you could argue, basically portrays that myth about people that don't want to go on benefits. But at the same time, some of the stories might be a bit more empathic. But Shameless, like, I haven't watched the UK edition. I learned it's a lot better. But the American edition that I've seen on Netflix, in fairness, you see people who are from very poor backgrounds, and you see they're very hardworking, they've got aspirations, but obviously society has dealt them a cruel hand. Capitalism has dealt them a cruel hand. And I think, in fairness, the lens is a bit empathic. I'm not saying for all parts of it, but for some of it. So yes, it can be really.
So there's something about the empathic lens and the way that the filmmakers and the people represent it.
Absolutely.
Do you think that TV and film should try to communicate some kind of important message about mental health, or should it have an agenda, or should it kind of be art without?
Yeah. Again, I think mental health is so important, and when you get it wrong, it can have dire consequences. So let's look at sometimes when it's gotten it wrong. Take, for example, One Flew Over the Cuckoo's Nest. That TV show with Jack Nicholson in it, I think it came out in 1975. It really was one of the reasons why people won't take up ACT. When you speak to the older generation, they're very reluctant to consider ECT because in that movie, ECT was seen as a form of control, wasn't it? Now, you could argue that a thing like that puts people off, but to some extent, we can flip it as psychiatrists and use it to have the discussion. Okay, what are your concerns? And some people say, One Flew Over the Cuckoo's Nest. Okay, are you aware that this is what this was? ECT is different. This is what the film says. This is what the film gets wrong. So we can flip it. But think about the stigma in terms of that movie and basically what it did in terms of treatment. But at the other time, I'll give you an example, like Hollyoaks. I don't really sit down and watch Hollyoaks, but there's one fantastic storyline in Hollyoaks. So there's a storyline in Hollyoaks where there is a woman with perinatal OCD. So she gives birth. So Hollyoaks always tries to be mainstream. So she basically gives birth around the COVID. And what they do, I've got to say, they really get OCD quite right. So they make a clear distinction in the TV show between the obsessive thoughts and the compulsions. So how they do that is they focus the camera on her and you actually hear the thoughts. Oh, I need to clean the bottle. What if my child contracts OCD? Oh, it's not clean enough. Then you hear it over and over again repeating. So the repetitive, the intrusive nature, then you actually see her spend time cleaning stuff. And then later on the show with a psychiatrist. And I think that does a lot to combat that stereotype. Take another movie, for example, like The Joker. So when you look at the Batman series and you look at the most recent Joker movie, you understand, you have a myriad of stuff. So the chap there, he has head injuries, he has explosive laughter, which could be a neurological condition, pseudobulbar. Then you see him hallucinating. Everything is mixed up together. And the problem with that is when we speak to our patients, when you mention a diagnosis like schizophrenia, because a lot of the movies, when they portray schizophrenia, it's often someone who is violent, you understand? And so it affects people wanting to accept the diagnosis or take the treatment. And you often get stuff like, well, I'm not violent. How can I be? I don't have a split personality. And sometimes movies portray this. And when they portray it, then they basically get it wrong. But I suppose you can say for like things like A Beautiful Mind, for example, with A Beautiful Mind, we get the sense that they're talking about things, but then there's a lot of focus on what appear to be visual hallucinations. And if you're not careful, you think that's the linchpin of schizophrenia, and not knowing that auditory hallucinations occur, more frequently than visual hallucinations.
What would be your recommendations for people working in popular culture to try and avoid big inaccuracies or potentially harmful errors?
Yes. So, Anya, very, very good question. I think generally, popular culture always says, yes, there needs to be entertainment, but why not get patients, service users, groups like Mind, pay them to get the story right. Because I think you can get the story right and also make it entertaining as well. They're not mutually exclusive. And the other thing is, when you get it wrong, be prepared to admit that you get it wrong, isn't it? And seek to learn and basically correct things. Because like I said, the damage you can do if you don't get it right. I'll give you an example. So you might have heard of this TV show called 13 Reasons Why. So 13 Reasons Why chronicles basically the story of a teenager that basically takes her life. And what the guys there say is like, okay, well, it talks about suicide. And yes, some research shows that after the show, people were basically looking for help and parents can have discussions. But the problem with the show is the sexual assault is quite graphic. That's one. Secondly, they are quite explicit with the suicide. And there are guidelines in how it's shown. But these guys actually are quite explicit with how it's shown. And what the research seemed to show was that after the TV show, after it was shown, there actually was a lot of, in addition to people seeking help, there was also evidence that people were checking pro-suicide websites. And as I'm sure you can appreciate, there's the risk of the contagion effect, really. So TV shows must get it right. So why not contact patient service users, groups like Mind, to make sure you get it right, especially if you realize you've got a responsibility to the public and still have your art at the same time.
Do you think that, or are you aware of times where things in TV and media have influenced policy, or has it been mostly, do you think, kind of public opinion and like you say, people seeking help, or like reading up about conditions on websites?
Well, that's a loaded question. Wow, Anya, you're coming with the smoke, aren't you? One thing I always say is policymakers should watch things like Top Boy, should watch things like The Wire, because it really brings about this concept of syndemics. So how do you have a syndemic where different risk factors add together to have a synergistic effect, which then is greater than the sum of the individual parts? So like with The Wire, you have living in a poor neighborhood, you have redlining, the same thing with Top Boy. You have draconian drug policies, then you wonder why people now have increased risk of mental health problems, really. And sometimes what the government try and do is play it as, oh, it's a class thing. So now you can't talk about critical race theory, and with the leveling agenda, they're making it seem as if it's a north-south divide, forgetting that even in areas like London, you have pockets of Black, Bangladeshi, Pakistani communities who are really an underclass at the same time. So I think these TV shows hopefully would be able to influence policy. And I'll refer you to some piece of work. So Jeremy Coyd, I believe he works with East London Foundation Trust. He actually published in the American Journal of Psychiatry, where he looked at gangs and violent gang members in Hackney. And basically what he said was that in terms of that piece of research, he showed that it was a public health issue. Why? Because a good number of those chaps that were interviewed, 50% of them were using drugs, and they were at increased risk of developing post-traumatic stress disorder and basically at risk of developing psychosis. And these are things sometimes we forget. So look at Scotland, for example. In Scotland, they treated knife crime as a public health issue. But in England, it's different. And it makes me wonder as a Black man, why are they doing this? Why is that in Scotland, it's a public health issue? They took a public health approach and it worked. But in England, they want to lock up as many people. They want to increase stop and search, and measures like that. So I do think maybe people are watching. Obama certainly said he watched The Wire. So I hope maybe The Wire actually helped with some of his policies, really.
It's infuriating, isn't it? You kind of almost want to shake people in power.
Absolutely.
Because it can sometimes feel like they're so on another level from what we working in the NHS might see day in, day out. And also what these programs demonstrate so clearly. Like, everything to do, I guess, stop and search, knife crime, drug policy. I guess my experience has been with cannabis and the ridiculously higher rates of stoppage and arrest for people
absolutely.
Who are Black rather than people who are white. And then the lifelong impacts that can have on somebody.
Absolutely.
They get the criminal record or they spend time in prison, the impact that has on mental and physical health. And it sounds like from what you've talked about, The Wire, very much addresses this. This knowledge is there.
And Top Boy as well from the UK perspective.
The stories are there. Why is no one listening?
Yes. And I guess it's important to bring this issue out. So you see racial gaslighting when you see things like the Tony Sewell report that said institutional racism doesn't exist in Britain. Like, are you for real? That's racial gaslighting. And like I said, the leveling up agenda. And again, yes, there are inequalities. Yes, we look at the white working class and the disadvantages people have up north. I'm not knocking it out, but you can carry both agendas along, not pit them against each other. And I also think we like to look outside, but let's look within psychiatry. Again, one of the things I would like to say, Anya, your institution, like the Maudsley, we look at Institute of Psychiatry. Let's look at the research of psychosis. How many Black folk do you have? And I know I could speak about other stuff, but for this one, I want to say, how many Black major psychosis researchers do you have? Because if you are not looking at these pictures, there are angles that Black folk being interested in their communities can come for. How many, in the Institute of Psychiatry? I don't know. Maybe that is something. So we also need to look inwards too. And I would even make it more sophisticated, Anya, and say, for example, I am a Black man who grew up in Africa, okay? I grew up in Nigeria. All my role models, all in my university, from the porter to the professors, they were all Black. So when I come here, I, along with my white colleagues, also need to basically show cultural humility. And that's to step back to realize that there are certain things I might not get. So with my kids, I'm always telling my kids, you need to work 5 times harder than white folk over and over again. So the pressure that puts on my kids, how they see their Blackness in terms of being in a society where the faces they see are white, the people doing major things are white. and the negative stereotypes of Black people. That's something where I look at, and I can go to my Nollywood movies or remember my time in Nigeria and be protected against. So there needs to be some degree of sophistication. So one of the things I talk about with cultural humility is that, which is your ability to step back, your ability to appreciate your role in the perpetuation of racism or inequalities, is Black Panther. Why Black Panther? So if you think about Black Panther, on one hand, you've got Killmonger. Killmonger is painted as the villain. He's grown up in America. He's seen the oppression of Black folk by white folk, white supremacy. On the other hand, you've got T'Challa. T'Challa is from this wonderful kingdom of Wakanda. All his role models are Black. And you see the tension between them, because Killmonger is like, you don't get the picture. Our people are being killed on every day. T'Challa is like, let's just maintain the status quo. We don't want to get involved in the Black struggle. And so a movie like that brings up those potential tensions in a way which has not really been explored in other aspects as well.
The cultural humility is something I think that you've spoken about before as well, and is really interesting. And the way that you say that we just have to be aware of the fact that however similar we think that our experience may have been, we need to be aware that it isn't. And I guess, like, whether that's issues of race or whether it's issues of, or, you know, perhaps our own lived experience of mental illness, or
absolutely
our own experience of deprivation or poverty, you know, it's how to look alongside the person, but without trying to tell their story for them, or yeah,
absolutely.
I guess something that I think you've talked about before is using films to process experience, or
yes,
and we mentioned at the start your work in the Black Psychiatrists.
Yes,
I wonder if you could talk a bit about that.
I could speak all day.
Please.
So we have the Black Psychiatrists Association of Black Psychiatrists, and I guess it was mainly about supporting us. We know about the reports, the Royal College of Psychiatrists report on the experiences of Black and other, you know, psychiatrists of color. I hate using that term of color, but, you know, BAME, if you want to use that term. So obviously we formed the association. And so what we decided to do was we formed this association, the Culture Club. For now, we're focusing on film. And we've watched films like The Five Bloods, The 13th by Ava DuVernay, one of the greatest directors. She is just... we watched The Five Bloods by Spike Lee, again, one of the best directors. And what enabled us to do was really have those conversations around race, looking at ethno-racial trauma, really being able to explore syndemics, being able to see things from perspective. So generally, we've tried to do it in such a way that we're not just looking at US things. We've looked at UK stuff. So I don't know if you watch the Small Axe series. Sorry, I know I'm dropping so many movies, but I'm just doing it deliberately. It's on BBC iPlayer by Steve McQueen. Very, very good. And it basically talks about the Afro-Caribbean experience. I think it's Red, White or something. And it's basically about a John Boyega's character goes into the police and the racism he faces. And as we started to discuss it and we did a poster. Dr. Talabi won the poster award. But we started being able to speak about our own experiences. And I was able to share an experience where I was teaching in Oxford on a CAS course, and police just raided my room and just basically accused me of running guns and being involved in sex trafficking. It was one of the most humiliating experiences. I was in my shorts and, you know, just being able to discuss it, and people were talking about their own experiences of racism. So it became cathartic and almost a bit like a balling group, really. We've not done, but we're going to start up again. And so we've done a post, and I think there might be scope to opening it up to a wider audience. I'm also looking at some of the African-American psychiatrists, because to be honest, some of them I've quoted some of their work. So people like Dr. Rup Shim, Dr. Deidre Anglin, they've published in the American Journal of Psychiatry. Dr. Ayana Jordan, she's done extensive work on race. Dr. Jessica Isom, you know, some of those people have spoken, worked in Yale, and Yale actually have a social justice equity department. So there's a lot of work occurring on this side of the pond. But then we also have advocates here like, Dr. Shibolade Smith, from the multi. So it's an exciting time, really. But the conversation has to be had. These difficult conversations need to be had. Looking at our patients, looking at why the overrepresentation of Blacks coming through the criminal justice system or through, formal routes rather than coming in informally, and stigma and all those kind of issues, really.
Yeah, and I guess going back to what you were saying about the lack of representation in academic settings, and I don't know about the statistics in just NHS settings, but I'm sure it's also not great. And then that takes you, doesn't it, to cultural humility, because psychiatry is so about culture. It's about how we express our emotions and how we do. That'll vary from like north of England to south of England. Never mind to people who've grown up, somewhere like London, where you've got people from all over the world. And yeah, if in your mental state exam, you impose your standards of normality based on your own upbringing, of course you're going to go wrong, and you just need that perspective.
Yeah, but can I just comment on that point? Me, whenever you bring an issue, I like to throw a TV show.
Please,
like I said. So I don't know. Have you watched The Chair? It is so funny and witty. So talking about racism in academia. So it's basically about a woman of South Korean origin who is the head in an Ivy League university English department, and it's interesting on how they look at sexism and racism. You understand? And it really deals with things like microaggressions and how ethnic minorities are basically treated in these white institutions, really. So it's really, really powerful. Another good one is Dear White People, where you see Black people in an Ivy League institution. It could be like Oxford or Cambridge, and their experiences in those institutions and how they often have to justify why they're in those spaces, because people are like, are you here because you had a sports scholarship? Should you be here? So for everything issue you can talk, there's always a TV show. And I think it's great because people can watch it and have the conversations. I think we need to be out there, BBC One Extra, Channel 4, and just basically having these discussions as psychiatrists. And I think psychiatry is a profession which, because we deal with the arts and humanities, it's very, very important. One other thing I wanted to quickly touch on is like TikTok. So I don't know, of recent there's been this talk about things like mass sociogenic illnesses. So there was this talk about why there was an increase in like Tourette's. So there was apparently this YouTube German guy, and what tended to happen was people started having the same kind of tics, vocal tics. So I think he used to say things like baby shark. And then Brain published on it, but they were very, very insensitive about it. You understand? Because they were almost implying that people were making it up. And people with like Tourette's and functional neurological disorders felt it was approached in a very insensitive manner. So, the world we're living in, we're having all kinds of things coming up. And I think it's important to have these things, the role of influencers, their responsibility, and basically having these discussions, really.
I had a question that's completely gone out of my head. So
Sorry.
No, don't be sorry. I'm sorry. Oh no, this was it. Comedy. Yeah, because you were kind of talking about, I got the Chair and Dear White People, both comedies?
Yes, and they are just so funny and insecure. So
do you think, is there, because I guess we've talked a lot about serious,
yes.
The Wire, the Top Boy, they sound like they're serious things. Are there anything that can't be touched by comedy, or how? Comedy
can be a very, very good way, you understand? And I'll define comedy broadly. So Insecure, like I said, funny as anything. The Chair, funny, Dear White People. But you get slapped around with these issues. So I keep on using the word slapped around. But what I'm saying is they don't hide these issues. They come up. And even sometimes things like stand-up comedy, really. I know of a psychiatrist who basically does stand-up comedy and uses it to communicate research. So stand-up comedy too. And as long as it's honest, as long as it's respectful, these TV shows, I think, are very good at bringing some of the issues that we need to have in terms of mental health out. So they don't. So in answer to your question, they don't always have to be serious like Top Boy, The Wire, and things like that.
What do you want to see be made that hasn't been made? What issues do you want discussed in popular culture that you haven't found through your work yet?
Well, that's it. I think everything regarding mental health. So look at like the neurodiverse population. So again, I was thinking, how would they tackle that? There was a show on Netflix, I can't remember. It's about someone with autistic spectrum disorder. Atypical. And again, there's so many TV shows. My daughter shows me, obviously you have to choose, because if not, I'll be in front of TV all day. But also, I don't know, did you ever watch Sesame Street? I grew up in Nigeria. Sesame Street was very, very big. They had a character called Julia. So she was a puppet with autistic spectrum disorder. And it was really interesting seeing people speak to the puppet character and have those kind of discussions. So I think everything can be brought up within, like I said, within popular culture. And I also think like when we have our conversations with our patients, do we discuss music? Do we discuss films? I certainly ask them, are you watching any TV shows? What do you like about it? And sometimes the issues of mental health will come up. I'm like, okay, what do you think? Was it portrayed? Is it similar to what you're watching? How is it similar? And you'll be surprised. Like the 13 Reasons Why, traditionally you read it, it's a horrible movie. I remember a patient of mine who had been self-harming some years ago said, I've watched it. I think it's helpful to know that other people are going through the same thing. So even something like that is portrayed as negative, some people find it helpful, if that makes sense. Do
you recommend TV shows to your patients if they're feeling alone in what they're going through?
I broach it with them, really. And I think you've got to be very, very careful because some TV shows can be triggering. So, for example, Euphoria, there's so much. I don't think it glorifies drug use. Some people have accused it of glorifying drug use. But to be honest, you see some of the scenes there, it can be triggering. For me, I like watching it because it's certainly helped me with mental health act assessments. It's helped me in taking a non-judgmental stance, reminding me, you understand? But I can understand how it will be triggering. If they're interested in TV shows and you've got recommendations, perhaps you can recommend it or have the discussion on the kind of things they like, you understand? So I would say yes and no, really. Sometimes I actually do recommend it if I think there's a particular good one. Okay, this particular part. Like I certainly would, for someone with OCD, I certainly would recommend that Hollyoaks episode. I think it's absolutely brilliant, really. So yes, I would recommend something like that, really.
Dr. Sule, I'm very aware of your time, but I'm just wondering if there's anything that I've not asked you about or anything that would be you'd like to share or discuss.
Check out movies. Basically, can I do a shameless plug?
Please.
Yeah, you can follow me on Twitter. It's basically at AK411 CAM. And just to say, people just about being open to watching movies and TV shows. And to psychiatrists, sometimes I always say with psychiatry or with medicine in general, you take the most quite creative people and we get beaten it out of us through guidelines and stuff. And let's not forget we're creative people. So be interested in your patient's subject material, their painting, their music, films. I, for example, I'm a massive hip hop fan, but I remember I'm happy to sing a song with one of my patients, you understand, if I have to. So let's not forget the humanities, the arts. Let's be open to movies. This is a time, and from the racial point of view, especially for Black TV directors like Spike Lee, Ava DuVernay, Steve McQueen, the Small Axe series, the 13th, there are just so many good movies, particularly on Netflix, coming out. So watch them and be open to learning from them.
Dr. Sule, thank you so much for your time.
Thank you for having me.
Thank you. You are listening to the Thinking Mind podcast. Thank you so much for listening to this episode. If you enjoyed it, please share it with a friend or give us a rating. It really does help people to find us. If you find the podcast valuable, why not buy us a coffee to help keep us going? There's a link in the show notes. As ever, we love to hear from you and love to hear what you think. So drop us an email or get in touch on social media. Thank you so much.